Hi, this is Patrick Horn, president of GHAPP. Thank you to our sponsor, AbbVie, for their support of this podcast.
Hi, welcome to the podcast. Today we'll be talking about mental and sexual health and inflammatory bowel disease. My name is Alison Krustapentus. I'm a nurse practitioner at Beth Israel Deaconess Medical Center in Boston, Massachusetts. And today I have with me Christie.
Hi, I'm Christie Morrison. I'm a nurse practitioner, lead APP at Oshie Health, and I work at Texas Digestive Disease, seeing inflammatory bowel disease patients there. So thanks for having us today.
Yes, thank you. So Christie, how do you go about speaking about mental and sexual health with your patients in IBD?
I think it can be a challenge talking about that topic with any of our patients, right? But in IBD patients, it's even more important because it's such a severe chronic inflammatory condition that it affects every part of their life, and especially their mental well-being and their sexual relationships with their partners, which can really affect also their mental well-being.
Absolutely. Absolutely. I think it's important to build that rapport with the patient. It is an important conversation to have, but oftentimes they're afraid to or don't know how to bring it up. So we have to bring it up with them because it really is important to screen. You know, our patients, like a third of patients have with IBD have anxiety, about a quarter have depression. I would say those are undervaluing what the actual numbers are. And then when they're in a flare, it's much higher.
I agree. And then when they're in their flare, but even when they're not in a flare, regardless of how they feel now physically, that anxiety can creep up because this disease is such an unpredictable illness. And even though they're feeling well now, they may have not felt well for so long that they're really chancing. Is this going to last for a while? And maybe if they have perianal disease or rectal disease, just having any kind of awareness of what's going on in their pelvic region is so concerning to them and causes such severe anxiety as well that it can really affect their sexual well-being, which then in turn, unfortunately, affects their relationships. And it's a cycle that just keeps going over and over. I love it when my patients will actually bring their partners or spouses with them because sometimes they can bring up those subjects a little bit more, but it's still something that's very taboo to speak about. So I think exactly like what you said, we've got to be the ones that initiate that conversation.
Mm-hmm. And really normalizing the fact that when you're in a flare, you're having that urgency, you're worried about those nocturnal symptoms, you're fatigued, and sometimes these medications have side effects. So it really is okay to feel this way. How do you usually screen for depression and anxiety?
For most of my IBD patients, I start with a PHQ-2 at the beginning of our visit. Sometimes that's harder if we're dealing with an urgent situation where we really need to jump into talking about their symptoms and management of their disease. But I will usually start there. And then depending on how that goes, it will automatically jump me into a PHQ-9 screening. I will also kind of look for cues as I'm seeing my patients. If I'm seeing a lot of anxiety talking about their disease, seeing some overlap maybe with some potential functional symptoms. If their disease is well controlled, then I may jump into a GAD screening as well.
Yeah, that brain-gut connection is incredibly strong. Where I usually do a PHQ-2, we are lucky enough to have an IBD psychologist in our group, so we can refer to her and just bringing it up. And even when they're not in a flare, I usually say, we have this opportunity for you to establish with her. And oftentimes they're curious. Sometimes it takes a few visits for them to really buy in. But she does CBT. She also helps with CBT with insomnia because a lot of our patients do have difficulty sleeping.
Yeah.
And then she does some gut hypnotherapy too, which is, we're so lucky to have that on staff.
That's amazing. We're able to have behavioral health providers at Oshie as well for all of our patients. And I'm so grateful that we have that available for our patients, but it's so difficult to find that in larger community settings throughout the United States. So having the ability to use that in a telehealth environment, sometimes we'll bridge that gap when we don't have a large IBD center nearby. But I think it's important, even when these patients aren't flaring, just having to think about having a chronic illness that's going to last for their entire life can be life-changing and alter their mental health because of that alone, not even related to their symptoms. So I really think it's so important to emphasize and make sure we are screening on a regular basis for that.
Absolutely.
Yeah. So I think we've really talked a lot about some of the interventions and ways to help treat our patients. One thing that you mentioned to me as we were talking before the podcast is that you really think that this should also be included in every health maintenance plan that we're talking with our IBD patients about. And we know that as IBD professionals, we sometimes become our patients' primary care providers as well. And so we really do need to talk with them about all of their health maintenance items. How frequently do you really talk about that with your patients? Is it at every visit or is it more once a year?
It really depends on what they're seeing me for. I do see a fair number of urgent patients, so usually we're not getting to that. If they're starting on a certain medication that needs vaccines, we're of course mentioning it. But usually in the follow-up visits, my patients on biologics, I usually see 3 to 4 times a year. So it does give us ample opportunity to go through health maintenance. And sometimes the visit is primarily that, making sure they have their vaccines, they're seeing their primary care once a year, seeing dermatology, and then also that mental health screening is right. I have a template in my note and make sure that I sort of keep that front of mind when we're talking about it.
Yeah, that's really great. Do you find that in this day and age that sometimes talking about these health maintenance topics can be a little bit challenging with some of the medical misinformation out there about vaccines?
That's a great question. I'm finding it more and more. We will document patient declines or what have you. I'm lucky where I feel like in the Northeast, we're seeing a little more openness to vaccines and things such as that. But usually, and we're also very lucky where we have most of the vaccines in our office. So we can sort of get them to say yes and then have the nurse come in and give them that vaccine at time of visit.
That's wonderful. I think that's a great strategy to kind of help make sure that our patients are getting vaccinated if you have the ability to give it there in the office. And again, it's a regional problem, I think, but more than regional, just in this advent of information that we're so lucky to have the internet and great resources out there. Sometimes the information is not always what we would necessarily agree with as healthcare providers. But I do think just talking about it with your patients and addressing their fears related to that sometimes will help you overcome that, but not always. So you just have to remember in your clinic, no matter what the situation is, to make sure that you are counseling about it because it is recommended and documenting if the patient declines. But it's a really important thing to make sure that we're doing on a regular basis. All IBD patients, unfortunately, have an increased risk of infection, even without certain biologics or advanced therapies. So making sure that we're covering them as much as we can. We're about to lead into the flu season coming up here. So it's been a conversation that I've definitely been having with my patients already as well.
Absolutely. My patients I saw over the summer that I may not be seeing until later in the fall or winter, I'm saying, remember to get that flu shot as a reminder, friendly reminder. Are you using any checklists or anything like that? I know they have those available for us, the Cornerstone Health.
Yeah, Cornerstones is great. I will sometimes hand that to my patients if they're asking about it, especially with a new diagnosis. They want to know, okay, what are all the other things that come with this? So I'll kind of give them a little packet that includes that. But otherwise, I just keep it in my template as well in my EMR. So I'm just checking it off once I see them. Most of the time, it's when they're not in a flare that we're really talking about these because it's really hard to talk about anything else other than getting their disease under control when they are in a severe flare. But outside of that, I keep it in their EMR and just pull it over from visit to visit. So I make sure that we're addressing it, that I'm double checking it because there are certain vaccines like the flu vaccine that need to be given more than once. So it's really great to have a lot of tools like that and most EMRs have that available.
Yeah, which is fantastic.
Yep. Well, Alison, this has been a great conversation today. It's so nice to meet you and talk about these important topics in our IBD patients. I thank all of our listeners for joining us today, and I hope you guys will visit the GHAPP website for additional information and education about not only IBD, but all other topics as well.
Thank you.
Thank you.